The first article that Ariana and I focused on was entitled "The Relations of Quality of Life in Patients with Lupus Erythemus, Regression Models versus Qualitative Comparative Analysis." In this retrospective cross-sectional design study, there were 161 participants, and the basis of the study was just to associate the power of sociodemographics such as age and sex with medical variables of our SLE patients, such as the type of lupus they had, the diagnostic times, and just the symptoms that were associated with their lupus. And we wanted to do all this in order to find out how these variables affected the patient's quality of life. SLE can negatively affect the patient's quality of life. SLE can lead to cognitive issues such as concentration difficulties, memory disturbances, and even delusions. Other things that SLE can affect were chronic physical pain, and chronic physical pain can lead to physical limitations, some of those of which can be permanent. And lastly, the study focused on psychological health of patients, and we found that with SLE, a lot of the psychological effects of patients lied in mood disorders. So the conclusion of the study found that there is an importance in early diagnosis of lupus. And since it's very uncertain sometimes to know when we have the disease, and since there can be very generalized symptoms, then we found that people who find out later that they have lupus have a lower quality of life than those who were diagnosed early. So women and older adults tend to fall into the category of people who take a longer time to get diagnosed with lupus, and that puts them at risk for a very detrimental quality of life. So as nurses, how we can incorporate this into our practice, or we can start by just spending time getting to know our patients, spending time in their room, and this will allow us to kind of detect and assess whether they fall into the risk category. And if they do fall into the high risk category, then we'll know how to develop a plan in order to just kind of assess, intervene, advocate for the patient, advocate for them having tests that will put them at an earlier diagnosis than a nurse who wasn't paying attention to their patient. And we also want to just basically make sure we assess for all the risk factors, and if they're at high risk, then we want to lessen the severity of their symptoms, and the best way to lessen the severity of their symptoms is to get an early diagnosis.
The second scholarly article that we have found is called "The Unconventional Pain Management for People with SLE, a Systemic Literature Review." In the article, that they found 1.5 million people in the United States live with SLE. 65% of these patients have chronic pain due to swollen joints and other symptoms related to the illness. Due to the risk of pharmacological medication issues such as their side effects, it's important to find different approaches to relieve the pain. Some of the side effects include serotonin syndrome, heart failure, atherosclerosis, and osteonecrosis. Also in the article, the National Pain Strategy recommends that therapists and nurses work together to create a care plan, which not only treats the chronic pain, but also the emotional and physical implications related to the disease. In conclusion, efforts were made to treat the pain with the people with SLE, focusing on interventions to decrease the pain in a safe and timely manner. The goal of the unconventional pain management was to minimize the pain improve the bodily functions, and increase the independence, which thus improves the psychosocial aspects and physical limitations. Also, the study showed that chronic cognitive behavioral therapy showed a significant reduction in the pain in the 3 studies. Also, in conduction after 30 sessions of 20-minute treatment, acupuncture and massage helped with the pain. But there was no significant changes in the pain reductions by aerobic exercises. So some nursing interventions that we could include with this article, like you go and start off with the first thing in ADPI, which is assessment. So you want to assess the joints. When assessing the joints, you want to look for decreased motion and like stiffness. You can encourage range of motion because range of motion will get those body moving and like loosen up the joints. And you could do that repetitively 2 times in each joint. Also, you can encourage deep breathing and coughing because I know sometimes with pain, it puts a struggle on your lungs, so that will help with your breathing. You could also refer patients to cognitive behavioral therapists. Also, you could include non-pharmacological methods to help with the pain, which will include like heat versus cold application. You could incorporate yoga or exercise. You could incorporate guided imagery, relaxation, basically just any activities that the client will enjoy and take their mind off of the pain and the illness that they're experiencing right now.
The third article was entitled Symptom Clustering in Patients with Childhood Onset Systemic Lupus Erythematosus. This was a correlational study design that was used in 2016. And basically what it does, it states that the understanding and the prevalence of symptoms perceived by childhood onset SLE and the patients and the disease symptom clusters may be helpful in managing these burdensome symptoms that affects the patient's quality of life. There were 75 patients in this study, and what they did here was clustered all the symptoms that SLE patients had together in groups. Ariana's going to go on to explain the clusters that were explained in the article.
Okay, so we have 5 clusters. In cluster 1, the signs and symptoms related to pain and itching. So underneath that, it has 4 different items, which include painful joints, painful muscles, headaches, and itching. In cluster 2, the signs and symptoms related to bruising and stomach issues, and the 2 items underneath it related to spontaneous bruising and stomach complaints. In cluster 3, the signs and symptoms related to weight gain. The 4 items underneath it included like a chubby face or chubby cheeks, and increased appetite, weight gain, and they had nightmares. In cluster 4, the signs and symptoms related to body image and circulatory issues. So they had 3 items underneath that, which included hair loss, sensitivity to light, and then white fingers in the cold weather. In cluster 5, the signs and symptoms related to the fatigue, which had 5 items underneath it. It include mood changes, fatigue, disturbed memory, loss of concentration, and vulnerable skin issues.
In conclusion, the article found that symptoms tend to occur together, and this may imply that the shared cause or the shared origin, and that it might be possible to deal with one symptom, and as you deal with that one symptom, simultaneously be dealing with the cluster of symptoms that were associated with that with SLE. So the article also found that there was fatigue. Fatigue was the most prevalent and the most burdensome symptom for these patients. And mostly the SLE is due to either the patient experiencing just very low sleep efficiency as compared to people without SLE, or it may have been, the fatigue may have been due to depression or anemia, just other signs and symptoms that are associated with SLE. So for our nursing interventions, we want to focus on our fatigue since that's the most burdensome symptom. And for fatigue, you want to encourage energy conservation. You want to teach the patient about activity and rest cycles. That's going to conserve their energy. And you also want to conserve their energy by teaching the patient good sleep habits, a bedtime routine, ways to get them relaxed prior to bed, such as a warm bath or a massage, so that they can sleep well, be less fatigued in the daytime. Secondly, for nursing interventions, we want to focus on our pain for our patients, and we want to teach the patient to avoid long periods of inactivity. Of course, this is going to affect the patient's joints and lead to immobility and those physical kind of limitations that we talked about earlier. And we also want to make sure that we administer our medications, our analgesics, and our anti-inflammatories at bedtime, so that these patients, when they're sleeping, they're not having any pain issues wake them up. And we want to also make sure that we encourage and teach the patient about frequent change in position during the night, so that will help lessen their symptoms of joint swelling and pain when they arise in the morning.